Hello everyone, I am Charlie Tolhurst and welcome to a video. Now, this video is going to be talking about the England coronavirus lockdown reaction. What do I think is going to happen next? So, on Monday, the Prime Minister of the UK, Boris Johnson, announced that he would enter England into a total lockdown. Yes, a third coronavirus lockdown to combat rising cases. The cases at the moment are surging across the country, and we got the grim figures the other day, yesterday, or on Tuesday, we had a very grim figure, 1,041 new deaths recorded within 28 days of a positive coronavirus test. Just like to say that figure is horrendous. It is the highest figure since mid-April last year. Really concerning. And a more loss of all those people. And the reality is we are in a situation which reminds us a lot of the 1941 Battle of Britain and 1940 as well, when we were in the Blitz. Basically, the dark times of those days sort of are envisaged today. We're in a lockdown. This is a historic moment for the country. Very historic. Not in a good way, though, and that we're in complete, total lockdown as of the time I'm speaking on the 7th of January. So, it's not good news. And the Prime Minister looked very sombre on Monday, and we had the announcement that England would be going into a lockdown. Very, very sombre news indeed. As well. However, though, yesterday in the House of Commons, there was a debate on the coronavirus legislation, which I got pretty off-putted by, actually, when there was just carnage from Matt Hancock, basically saying that the restrictions would be lifted in a staged fashion, but also making the point about the national lockdown. He was asked a question yesterday by a Tory MP who basically told him, when are these restrictions going to end? Now, he doesn't have any idea, but what he said was quite false. I didn't really get what he said. He basically meant that the legislation that is in place now can last up until the end of March. So, is he saying that the lockdown's going to be lifted at the end of March? Is it going to be lifted in the middle of February? We don't know. Of course, it depends on a number of people who can get vaccinated. And of course, the government have started already vaccinating the over 80s, over 70s. They're doing the extremely clinically vulnerable as well, I believe, in the coming weeks. So that's good news for you there. But of course, the other night we had 60,000 cases and over nearly 3,500 hospitalisations, which is enormous. Hospitals really under immense pressure in the NHS frontline. Many nurses and doctors having to work flat out to deal with the national emergency at the moment. Very hollow indeed. But yeah, the legislation passed with an overwhelming majority because Labour supported the measures that were in place, won by a massive majority in the end. Then we have Gavin Williamson on in the House of Commons yesterday. Basically, once again, the Education Secretary is being rather, should I say, lacklustre. Gavin Williamson is just, he's lost the plot now. We've got the announcement yesterday that all exams will be cancelled for the second year running. It's now going to be on teacher assessed grades. I do think teacher assessed grades will be better because we hopefully won't get that stupid algorithm thing we had last year where it got changed and then several thousand students got downgraded their A-level results and then their GCSEs got upgraded or something. So yeah, it's not good news for that forefront. But yeah, the main news he mentions that if schools go back after the February half term, given that the restrictions can be lifted then if vaccinations are up at a good rate, is that they're going to have mass testing in secondary schools and in schools. Gavin Williamson, you said that last time, and what did I get from teachers? Lots of negativity, lots of criticism. Basically, mass testing does not work. You're going to get thousands of students that are going to test positive. I know the most vulnerable are vaccinated, but we're going to get people that test false positives, false negatives. And basically, how's the school going to even open when you're doing mass testing? We need to start vaccinating teachers in schools. And I'd even say some students as well who are clinically vulnerable. We need to start prioritising teachers for the coronavirus vaccine. Whether it's the Pfizer jab, whether it's the Oxford AstraZeneca coronavirus vaccine. We've got to get teachers on the priority list for the COVID vaccine so that schools can reopen safely, hopefully next month. I mean, look, this government needs to focus on vaccinating many people. And the other day, Tony Blair was on Good Morning Britain with Piers and Susanna. Tony Blair, former Labour Prime Minister of this country. Usually, Tony Blair, of course, you may know him because he's one of the people that started the Iraq War, the wars with Iraq, that sort of conflict about 15 years ago when he was in power of the UK. Guess what he said yesterday? We need to start vaccinating. We need, basically, to recruit as many people as we can to get this vaccination. And Tony Blair actually spoke with pretty massive optimism the other day. And what he said, he was the one that endorsed the government to change the rules on the vaccine dosage. So in other words, you get your second dose now after 12 weeks. Or 12 weeks later than you do with 3 weeks. So he was the one that sort of persuaded the government to change the approach. And that basically meant that the government could vaccinate more people. And this is what Tony Blair has. He's showing proper leadership to the government. The government are now starting to take this on board, which is really good. And basically what we're saying now is that Tony Blair wants people from like the army, the military, some doctors and nurses to come back from being retired to come and help with the mass vaccination programme. There is also going to be several more vaccination centres opening next week. We're going to have one in the ExCeL Centre in London. I think apparently Tottenham's White Hart Lane's going to have one. There's also going to be one at the Epsom Racecourse as well. There's also going to potentially be some motorway service stations popping up to use as vaccine centres as well. This is fantastic. If we can get these centres open, this means we can start vaccinating more of the population. We can get through this faster. He mentioned that if the government keeps opening more centres up, they can increase the capacity for the number of people who can be vaccinated. So 2 million a week, 3 million a week, 4 million a week, 5 million a week potentially by February. If we can increase capacity, only if the government gets their foot down and starts really accelerating this vaccination drive off. Because this is something that I really want to see. I really want to see the government accelerating their vaccine deployment. We've already done over 1.3 million Brits. We can get done more within the next week. And this afternoon there will be, or this evening there will be a press conference from the Prime Minister Boris Johnson on the vaccine rollout at 5 o'clock Greenwich Mean Time. Now, with lockdown in, the police will be back enforcing the new rules. So you're only allowed to leave your home for very limited reasons. Household mixing's banned. You should only leave your home unless it's absolutely essential. You cannot work from home. You can go in, but you must obey social distancing rules. You can also go out to exercise as well, once a day. And you're also allowed to leave your home to go shopping for basic necessities like food and medicine as well. And you can also leave to get a COVID test, or most importantly, if you're asked to get vaccinated, please do. It's a very important, as you will protect yourself and the community from COVID-19. Now we move on to government. Well, can I say to Boris's cabinet, this is the most low-grade government I have seen in my life. Can I say that I have seen loads of failed leadership during this crisis. I want to start with a couple of MPs that I don't think have done that well during this crisis. I think one of them has been Matt Hancock, the Health Secretary. Yes, I know I've been saying this. The Health Secretary, Matt Hancock, who failed to get a grip last year on testing. Then we had a massive scandal with PPE, which frankly really annoyed me with the NHS healthcare workers. And then we also had Robert Jenrick, who's the community secretary, basically tries to overpromise things, say schools are safe, then he says that apparently, we're going to let people move house. And it's very false, doesn't give you much clarity. It just sort of feels very sorry for people. And also as well, whilst we're here, he also announced back in March that all the clinically extremely vulnerable would have to shield. And now, if you are clinically extremely vulnerable watching this, you have to shield again. I mean, it's going to be heartbreaking for many of those. Some people are spending time alone. Some people are spending time with their families. So it's going to be a very difficult period for them. They're not allowed to go to work. They're not allowed to go anywhere pretty much. They're basically stuck at home. Just basically glued to their own houses. It is such a shame. And I do hope that they get extended financial support so that they can massively be helped throughout this crisis as well. So that's pretty much it. As for the weeks ahead, I'm going to say that again, very difficult weeks ahead. Sadly, as I've said at the start of this video, the number of cases will still continue to rise over the next week or so. We're expecting the second wave to peak very, very soon as well. And cases are still going to rise. Deaths will sadly continue to rise. Well, many more families will sadly lose loved ones before their time. And also, another big thing that I know a lot of people are getting to me is that another issue that I think people have got to understand and look in the eye here is that this lockdown is very, very important for slowing the spread of the virus down. But mental health as well is going to go right up. Depression, anxiety, children being off school because they're shut at the moment. Online learning being permitted at the moment as well. But I also just know the number of people who are working, who have lost their jobs, self-employed, sole traders. This is going to be a very difficult period for them because many of them could not physically go into work. Their businesses are shut. They're having to work from home. So it's impossible. Hospitality businesses especially have bared the brunt of this crisis. And with the figures we're seeing yesterday that I mentioned at the start of this video, it's very clear that the NHS is in a worse position than what it was in the first wave of the pandemic last year in April. And yeah, unfortunately, the next couple of weeks will be a hard struggle. However, I am confident if the government can get the vaccination drive finally ramped up next week, we're going to have more doses of Oxford vaccine. There's even talk of more vaccines coming, but I'll keep you updated on that as we speak. Hopefully next month some restrictions can be lifted, but it's only if we all play by the rules and follow them. And I have to say, the other day in London, all you people out there who are protesting for the anti-lockdown protesters, you should be ashamed of yourselves. You are putting the NHS under great risk. These people work tirelessly, flat out on the front line to really drive forward this national response. Please, guys, don't say this is a hoax. This is really serious. It's real, and you must believe it as well. And this is a very, very important time. People should be coming together. The members of the public should be coming together and driving this effort forward. So I will keep you updated on all the latest news from the pandemic as we go forward. But at this current moment of time in national emergency, please everyone, stay at home, protect the NHS and save lives. And of course, for the government, vaccinate Britain. Thank you for watching. Take care. Goodbye. And stay safe, everyone.